Hello and welcome to NCTV episode 124. As I'm filming this, we've just had the excitement of the Winter Olympics 2026, and this just so happened to have coincided with the February half-term week, which meant that a lot of people swapped the Sussex pavements here for the snowy mountains and the slopes. And over the past week or two, I've seen quite a few number of clients returning from skiing holidays, bringing home memories, photos, and occasionally a slightly unhappy knee, hip or shoulder. So today is all about winter sports injuries, the most common ones, why they happen, how to reduce the risk, and what to do if things don't quite go to plan. So why do sports injuries occur at winter? Whilst they are brilliant fun, they do combine a few challenging factors such as speed, cold muscles, unfamiliar movements, variable terrain, and sometimes confidence that exceeds ability. Add altitude, fatigue and long days on the slopes, and it's easy to see why injury rates rise during ski season. A fun fact for you, or not as the case may be, recreational skiers are actually most likely to get injured on days 3 to 4 of their holiday when fatigue sets in but confidence peaks, so remember to bear that in mind. Looking now at the most common winter sports injuries, when skiing, the big one here is knee injuries, particularly ligament strains. Why? Because ski stays firmly attached while the body twists, and knees aren't especially keen on that arrangement. Thumb injuries are also common from holding ski poles during falls, and this is often called skier's thumb. Also when snowboarding, snowboarders tend to fall differently. Common injuries can include wrist fractures and sprains, shoulder injuries and collarbone injuries. Especially in beginners learning the art of stopping actually, and that usually involves gravity. Aside from these, there are some general winter sports issues that commonly occur. Even without dramatic falls, I often see neck and back stiffness, muscle strains, hip tightness, and post-travel aches after long drives or flights. It's also worth noting that sometimes the injury isn't the slope. It can also be from 8 hours in ski boots, followed by enthusiastic après-ski dancing. Moving on to some prevention tips if you are yet to go away. Remember, a little preparation goes a long way. Build leg strength beforehand with squats, lunges and balance work, and this will help massively. Don't skip the warm-up as well. Cold muscles behave like blue tack, not very flexible. And pace yourself early in the week. Day 1 is not Olympic final day. Stay hydrated. Altitude and cold air dehydrate you faster than you think. And stop before exhaustion. Most injuries happen late afternoon when the legs say stop, but your enthusiasm says one more run. If you do pick up an injury, first things first, don't panic. For minor strains and knocks, rest and reduce the load for a few days. Use ice early on if swelling is present. Keep gentle movement going where comfortable. Avoid the temptation to completely immobilise unless advised to do so, as movement, introduced sensibly, usually helps the recovery. And yes, sadly, walking it off immediately after a fall isn't always a winning strategy. As you may have guessed, osteopathy can help, and it often fits in really well after a ski trip by restoring joint movement, reducing muscle tension and guarding, supporting recovery after sprains and strains, improving posture and balance, and helping you return to normal activity safely. Often people wait weeks hoping things will settle down, but early treatment can prevent smaller issues from becoming longer term problems. So if you're going to, it's best to seek treatment sooner rather than later. Other helpful support is available too, and depending on the injury, recovery may also include sports physiotherapy, strength and rehabilitation exercises, massage therapy, and guided return to exercise programs. It's rarely about one particular treatment though, it's more about the right combination for you. One reassuring reminder, most winter sports injuries are often very recoverable. The key is addressing them early rather than pushing through the discomfort once you're home. And falling over in snow can look quite graceful, but falling over, putting your socks on 2 weeks later because you're still stiff and sore, tends not to be. So if you've come back from the mountains feeling a little more stiff than sporty, or something just hasn't settled as expected, it may be worth getting it checked out. And that's it for today's bite-sized tip to help your health flourish. Stay upright where possible, and I'll see you again next time. Bye for now.